plan is to put up some content on here, encourage you guys to subscribe and to become a contributor here. And for this to be a place where you can talk amongst yourselves, share, and just hang out from time to time. I've been in the perioperative arena, for those of you who are new here to the medical field. The perioperative arena in a hospital is a specialized zone that's dedicated to patient care before, during, and after surgical procedures. It encompasses several key areas and functions. All of this aimed at ensuring the safety, efficiency, and success of surgeries. It is typically divided into three main phases. There's the preoperative phase, things happening prior to surgery. There's the intraoperative phase where surgery's happening, and the postoperative phase, those things as it relates to taking care of them after the procedure. Each phase involves a multidisciplinary team of healthcare professionals working together to provide comprehensive care. Let's go into a little bit about the key areas in the perioperative zone. There's the admission area / pre-surgical holding area. Patients are prepared for surgery here. This includes verifying patient identification, the surgical site, and all of the consent forms are signed in this area. The IVs are typically started, and the administering of some preoperative medications are done before surgery. Then there's the preoperative assessment, where nurses and anesthesiologists assess the patient's medical history, vital signs, their overall readiness for surgery. So that's the preoperative area. Then there's the intraoperative area, the during surgery phase, the operating room. So this is inside the sterile environment where the surgical procedure takes place. Surgical team, including surgeons, anesthesiologists, surgical technologists, and nurses, work together to perform the actual operation, the intraoperative area. Then there's the anesthesia work area located in this area. This is where anesthesiologists or nurse anesthetists manage the patient's pain control, sedation, and vital signs during the procedure. Then we have the post-operative area after the surgery, which typically happens in an area called the post-anesthesia care unit, or the PACU, also known as the recovery room. So this is where patients are monitored as they wake up from anesthesia. They're closely observed, their vital signs, pain levels, and the surgical site conditions are assessed regularly. Once the patient is stable, patients are then transferred to either step-down units or surgical wards for continued recovery and observation. So some of the roles of the different people in the perioperative arena includes surgeons, obviously, anesthesiologist and nurse anesthetist administer anesthesia and monitor the patient's physiological status during surgery. Surgical technologists are assisting the surgeons by preparing and passing instruments, ensuring that the sterility of the sterile field is intact. They're handling equipment and instrumentation during the procedure. Perioperative nurses or OR nurses provide care before, during, and after surgery. Sterile processing technicians ensure that all surgical instruments and equipment are properly cleaned, sterilized, and are ready for use. Sterile processing is a critical component of the perioperative area. It ensures that all surgical instruments and equipment are free of contaminants and safe for patient use. Here's how sterile processing integrates into the perioperative workflow. Instrument cleaning and decontamination. So after surgery, used instruments are transported to the sterile processing department for thorough cleaning and decontamination to remove biological debris and pathogens from the instruments that were used. Sterilization. Instruments are sterilized using methods such as autoclaving, which is steam sterilization, chemical sterilization, or other advanced techniques to eliminate all microorganisms. Assembly and packaging. Sterile processing technicians assemble instrument trays according to surgical requirements and package them to maintain sterility until they're used. Storage and distribution. Sterilized instruments are stored in a controlled environment and are distributed to the operating rooms as needed for upcoming surgeries. Quality control. SPD staff perform regular checks to ensure sterilization processes meet strict standards, reducing the risk of surgical site infections, or SSIs. Infection prevention. Proper sterilization prevents healthcare-associated infections, which are major concern in surgical settings. Patient safety. Ensures that all instruments are safe for use, reducing the risk of complications. Operational efficiency. The surgical team has the right instruments at the right time, minimizing delays. Regulatory compliance. Hospitals have to adhere to strict guidelines in the form of OSHA regulations, AORN professional guidelines regarding sterilization practices, and SPD plays a key role in meeting these standards. The perioperative arena is a highly coordinated environment where patient care and safety are prioritized. Sterile processing is an integral part of this area, ensuring that all surgical instruments are clean, sterile, and ready for use, thereby supporting successful surgical outcomes. In sterile processing, this is what we do. We support the operating room. From time to time, I'd like to share some stories about my experiences in the sterile processing department, in the operating room, at major university hospitals, where I've managed and directed, where I've had the opportunity to work in some of the largest sterile processing departments in the country. I'd like to share some of those stories and hear some of yours.